So my project is looking at the effectiveness of mindfulness as a mental health intervention for adults with autism and intellectual disability. Currently, there's a pretty big gap in terms of evidence-based mental health interventions for the subpopulation of the autism community that has intellectual disability. And that specific subpopulation comprises about 30% of the overall autism community. The reason I'm focusing on adults with autism and intellectual disability is because they tend to have poorer mental and physical health outcomes than the broader autism community as a whole. And the broader autism community as a whole tends to have poorer mental and physical health outcomes than the neurotypical population. So the autism and intellectual disability, or ID, population are in certain ways at a double disadvantage, and we generally just don't have a good idea of how to promote mental health for them. There's a lot of focus on supports and intervention for children, but we tend to see a really big what we call services gap or services cliff for adults. So that's how this need was identified. And we're focusing in on mindfulness as an intervention because there's been ample evidence in the research literature to show that mindfulness has been effective for adults with autism without intellectual disability, as well as adults in the neurotypical population. Another advantage of mindfulness, which generally is an approach that focuses on teaching you to be aware of and notice your feelings and your thoughts and accept them non-judgmentally. It's got an advantage for adults with autism and intellectual disability because there's a lot of different ways that you can take this approach and make it more concrete and more accessible for adults who have difficulties with abstract reasoning, which tends to apply to this population. We also think that it will have advantages for autistic adults with intellectual disability because there's a few different ways that we can take mindfulness approaches and teach physical approaches to practice mindfulness. For example, tensing and releasing muscles, holding on to objects, taking big breaths. These are all relaxation strategies related to mindfulness that are easier to teach to someone who would typically have communication difficulties, such as this subpopulation. Another element of this is we're targeting the dependent variable of emotion regulation. And the reason we're targeting emotion regulation is because there's ample evidence to show that it tends to underlie a lot of different examples of psychopathology in the neurotypical and the autistic populations, such as depression and anxiety. It's also, by targeting a singular construct, it makes it a little bit easier for us to directly assess the effectiveness or the efficacy of mindfulness for autistic adults with intellectual disability. There's also another advantage of mindfulness is that there's decades of research evidence to show that it's helpful not just to promote mental health, but physical health as well. It's been explored a lot in cancer research, in stress research, to promote more positive outcomes with other common health conditions such as diabetes. So my hope is that with this intervention, by adapting it to specifically target emotion regulation, this research may also lead to spin-off work that can look at its helpfulness to promote physical health and well-being as well. So globally, my hope is that this line of research, by developing a mindfulness-based intervention for autistic adults with intellectual disability, my hope is this pilot will lead to a lot of future work that can continue to grow the evidence base for mental health interventions for this subpopulation of the autism community, which historically has been neglected in health research. This is really a tragedy because they're at such a great risk for poor health outcomes.